Okay, so some people do not know about what abortion is. Okay, now they all know that once you just terminate your pregnancy or once your pregnancy destroyed, it is termed as abortion. That is not the case. Okay, so we said abortion is a termination of pregnancy before 20 weeks. So any form of pregnancy that terminates or that destroy before 20 weeks of gestation or pregnancy, we said it is known as abortion. But after 20 weeks, if you terminate or destroy your pregnancy, or if the pregnancy destroy after 20 weeks of gestation, we call it preterm. We call it preterm. So it is not what you think all the time. Take note of that. All right. So today we're going to look at what abortion looks like. Please, if you have not yet subscribed, kindly subscribe. Don't be wicked. Subscribe to my channel, and then whilst we grow the channel, please take note of that, and then also you share, you like. It's very important for us to also grow the channel. So any pregnancy that ends before 20 weeks of gestation, whether spontaneous or elective, okay, or elective, it is known as abortion, and that is exactly what we explained. Now we have types of abortion. We have miscarriage, and the miscarriage has to do with what, when the pregnancy ends because of what, natural, causes. Okay, so any form of what pregnancy that terminates before because of any natural causes, we call it at miscarriage. That one is not intentional. And then we have induced. Induced one has to do with what, the spontaneous elective reason for terminating the pregnancy. Maybe there was something, there was a problem, okay, and the problem was not from you, something happened, or sometimes you also cause it. Okay, maybe you tried and then it didn't happen, or you took in anything. Okay, so we have to go in there to terminate the pregnancy. It is what, therapeutic, in order to save the mother. So that's why we said um elective what, pregnancy. And then we have the induced. With the induced, this is also part of the elective. Yes, okay, so that is the induced one. And then we have threatened abortion. Okay, threatened abortion is also there. And then complete. Complete, with the complete one, we said every product within the uterus or the womb has been brought out, meaning there's nothing left inside the womb. We call it complete abortion. And then we have missed abortion. With a missed abortion, okay, the product retained, some of the product retained within the uterus or within the womb. So it means you're going to see some of them. And this thing, when it happens, please try and quickly rush to the hospital, because something might happen if you don't do it because of what, retained product. The patient can bleed. You can bleed severely. Okay, so take note of that. Now that we know the types and what abortion is, let's go and look at some of the risk factors and then causes of abortion. In fact, there are a lot of factors, there are a lot of things that can cause what? Abortion. A lot of things. And then a lot of risk factors. Okay, now one of the risk factors is what? Not financially prepared. Okay, not financially prepared. And this thing can happen to anyone, especially when you have a lot of children and then you see that financially you are not stable to take care of the new one, and you know how diapers and everything cost nowadays due to the economic system. This is also one of the things that really affects pregnancy, and then because of this, some people will decide to terminate the pregnancy. And then also relationship issue. If you have unstable relationship, okay, it can trigger an abortion. It's one of the things that can lead to abortion. And then also fear of dropping out of education, especially when it comes to the youth. Okay, when it comes to the youth, it's also very, very common with them. Okay, so fear of dropping out of school or education can be a factor, or some of the things that can lead to abortion. And then it can also be accident. Okay, accidental, when you fall, or trauma. Okay, trauma or accident. This thing can also happen. Okay, and then some form of medications. Some medications too can lead to abortion. And then also incomplete service. Incomplete service. You know, some people, they have frequently done abortion, and because of that, okay, their service has been so loose. With this particular one, incompetent service rather. Okay, it's not incomplete. Sorry, incompetent service. Okay, so incompetent service is very, very dangerous for pregnancy, because you know the service is supposed to be sealed right after pregnancy occurred, so that nothing go in, nothing come out. Okay, from the womb. And because of this, if the service becomes incompetent for this nature, one thing that can happen is that, okay, abortion can occur. This is very important, so take notice of it. And then also advanced age. Advanced age is also one of the things. Okay, advanced age, when you try to get pregnant at the age of maybe 30 years and above, or 35 years, advanced age can trigger abortion. And then also celiac disease. Celiac disease. Smoking is very bad. Smoking can lead to abortion. And then alcohol can also lead to abortion. Cocaine use, and then high caffeine intake. High caffeine intake can all lead to abortion. So if you are trying to get pregnant, and then if you are craving for pregnancy, then please try to avoid all these things. It is very, very important, okay, for you to get pregnant, maintained, okay, for you to get your pregnancy maintained. All right. Now, let's look at the assessment finding, or the signs and symptoms when it comes to abortion. We have pain. So in the initial part, okay, or the early stage, there is going to be pain, or pain and then crampy in the pelvic area, or the what, or the lower back. Okay, the lower back or the pelvic area, there's going to be a pain over there, and also bleeding from the vagina, and then spotting. It has to do with what, a light bleeding from the vagina. Sometimes you see all this thing in your pants. Okay, when you see that, it might indicate that you are having abortion. You have to rush to the hospital. And then also some kind of clots and some tissue through the vagina can also appear. So when you see these things, you have to also rush to the hospital for checkup. It might be abortion. And then also severe bleeding, and then signs of shock. When it comes to the signs of shock, okay, the pulse rate will increase, your blood pressure will start decreasing, you feel dizzy, and then you feel like fainting. Okay, you have cold, clammy skin, especially when it comes to the hands and the feet, the peripheral, the periphery. Okay, all these things can happen. Cold, and then cold extremities and stuff. When you see all these things, please try and then quickly call for help, because you might need it, and then you might need to be sent to the hospital. It's very important. Okay, so these are some of the things that can lead, that you can see whenever you have abortion. How can we manage it? Management play a major role, okay, in NCLEX, and then we talk about how we'll be able to prioritize some of the information. Okay, so we have to maintain bed rest. In fact, maintaining bed rest is very important. So imagine someone bleeding. When you are bleeding, it means that you are likely to what? You are likely to faint, or you are likely to have dizziness. So bed rest is very important. We have to also monitor the vital signs, the blood pressure, the pulse rate, the temperature. Everything is supposed to be monitored. And then remember the respiration, because when you are going to shock, it will have a lot of what? Problems that goes through the system. We have to take note of that. And then monitor for cramping and bleeding. The patient is going to have cramping and bleeding, and all these things are very worrying to the patient. And then we have to also count and weigh perineal pus to evaluate blood loss. In fact, somebody who is bleeding, is very, very difficult to estimate the amount of blood loss. So how do we do? The patient is going to have a pad, okay, inserted. So we are going to count the pad. Now we weigh the pad, and each soaked pad is going to weigh what? Each 1 gram of the soaked pad is what? Is going to be equal to 1 ml. Is going to be equal to 1 ml. So take notice of this in the NCLEX exams, okay? Especially when someone is having bleeding. With the pad count, is very important, okay? So 1 gram of the pad indicates 1 ml. So if you weigh the pad and it weighs like if it weighs like 5 grams, it indicates what? 5 ml as it goes. And then also we have to maintain IV fluid. Of course, intravenous fluid is very important when the patient is having a severe bleeding, or a high intake of adequate fluid, especially when the patient is conscious. Now take note of this while solving the NCLEX exams. When someone is unconscious, don't give anything by mouth. When someone is unconscious, nothing is supposed to be given by mouth. So it means you need IV infusions, okay, or intravenous infusion. But if the patient is conscious, then in this case, we can give what? Adequate fluid intake. So you take note of that in NCLEX exams. And then we have to also prepare for signs of shock. What are the signs of shock? Increase in pulse rate, decrease in blood pressure, okay, cold, clammy skin, and then the patient having dizziness, and then the consciousness level of the patient alter or changes. All these things are indicating indication of what? Shock. We have to try and then pay more attention to them, and then we manage it because the patient is losing a lot of fluid. This comes to one of the areas in prioritization questions that we have to be careful, especially somebody with abortion or having a spontaneous bleeding or having bleeding severely. It's very important in prioritization question. Okay, take note of that. And then we have to prepare for dilation and then curettage. Okay, the DNC that we mostly talk about. Okay, as prescribed, because we need to evacuate the product when the patient life is at stake, when the patient life is threatened. Then we need to try and then eliminate the pregnancy by doing the DNC, dilation and then curettage is very important. And then one of the important areas in NCLEX is that, we can also decide to give ROGAM because of the exchange of blood if the mother is RH negative. If the mother is RH negative, okay, we can give a ROGAM. And of course, ROGAM will help to protect the subsequent pregnancy, especially when the mother is RH negative. I will find time and then we talk more about the ROGAM and its pregnancy, termination onwards. And then also, we have to also provide a psychological support. Okay, psychological support is very important in this case. Why? Because the patient might need the pregnancy, okay, seriously, and then here's the case, it has been terminated. So these are some of the management that we can talk about. Please, if you have not yet subscribed, kindly subscribe, and then you share, you like, and then for people to also know. Please try and do this for us to also grow the channel. Please, we count you out. We count you for this. And then for all your NCLEX needs, try and contact American Dream NCLEX Prep for your ultimate NCLEX content, and then how you'll be able to go by, especially when it comes to prioritization questions, and then how to solve questions. Okay, it's very important. Have a nice day. Bye-bye.